Hi, good afternoon. We have a very special patient, Mrs. Squire. She is actually a retired nurse. She's actually in healthcare. She treats patients, so having good healthcare is very, very, very important to her. I met Pi a couple months ago, and Miss Squire, Pi, has also a phobia of the dentist. But I'm not going to say anything, but I'm just going to have her articulate what she had done. She had Allon4 implants on the bottom, but how her experience was before. She saw several dentists before she came to us, and what has her experience been from a overall, like, you know, letting her fears go and being more relaxed at the dental office to how she looks with her implants. So please, you know, introduce yourself.
Well, my name is Pi Squire, and I am a nurse. I have my degree in health education, my bachelor's in science of nursing, as well as a master's degree in psychopharmacology. I had a horrible experience when I was a child. I was about 9 years old and living in the Canary Islands. And their idea of dentistry was to strap you down to a wood chair and belt you in, and then they actually worked on molars without any anesthetic. And since then, I have a pretty healthy fear of coming to the dentist, to the point where I let teeth rot. I lived with broken teeth. I had a denture that was ill-fitted for 11 years. And finally, I broke my bottom partial. And I had seen about these implants and wanted them. So I started on this venture, this journey to try to get this done. And I was very fearful, and I saw four dentists prior to coming here. And I would go in for the consultation. Sometimes I made it through half the consultation, sometimes not. I made it through a couple fully. And I came here and I sat through the video, and I called my sister twice and said, I'm gonna run out, I'm leaving, I can't do this. And she coached me, I stayed, and I met with doctor, and it was a different experience. I actually canceled a dental appointment that I had for 2 days later. It just was the total package. It didn't feel like I was getting sold a bill of goods. You actually said, how can I help you? And I thought, wow, okay, I'm not sure. And I left that day going, I'm not sure what I want to do. I came back again for another consultation and left again. The experience has been very good. It was minimally painful. I mean, you have surgery, it was uncomfortable that day. I didn't really need any pain medication after the first day. You know, the whole eating, chewing thing has been phenomenally better. I feel like I've lost years off my face and chin. You can really see the difference. I did my own before and after, and it looks amazing. And today, for the first time in my whole life, I didn't pre-plan my appointment. I just got up, got dressed, and I walked in here just not shaking, not fearful, not scared at all. I was quite comfortable, so I'm actually excited.
Your face looks so awesome. You're smiling literally ear to ear, and I've told you this is the most relaxed I've seen you in the last 2 to 3 months since I've known you.
Yeah.
So it's such a positive experience, and you look great. You're feeling great. So thank you for sharing. And then if you're say someone like yourself is either fearful or apprehensive or concerned as a healthcare practitioner, what would your
Oh my gosh! Aside from being incredibly professional, your staff and trust me, I wouldn't be doing this if I didn't believe it. Your staff is incredible.
Thank you.
I mean, I feel like I could tell them anything. I mean, I've had blankets put on me. I've had hand holding, above and beyond what I have experienced. And I have gone to many dentists throughout the years because it's been hit. You know, you go once, you have a little bit done, and then you just vanish. You don't go back again. For me. So it's just been an incredible experience. Very professional, very clean. As a nurse, you know, I look for things, and very clean, I've been very happy.
Thank you so much. This means a lot that you're able to share this with us and our audience, and we're just looking forward to seeing at your next follow-up visit.
Yeah.
And once your permanent teeth, we're ready for the permanent teeth. It's only going to get better. But just with your temporary teeth, and you had this done what, like about a month ago, 2 months ago?
About 2 months ago.
2 months ago.
Yeah.
So in about a month and a half, we're ready for fitting the final teeth. But just in a month and a half, 2 months, it is an incredible transformation. And
Oh,
it was
yeah.
all done in one day.
Oh, it's amazing how it's done in one day, and I feel young. I mean, I spend time touching my mouth because it feels different. It feels good.
Fantastic. Thank you so much.
Thank
Really
you
appreciate
so
it.
much.
Thank you.